Hi, this is Greg Sconce. I'm president of InfoStar, and it's my pleasure to give a brief presentation on the new Dental SideKick MP, which is multi-platform chairside patient education program. This software will load onto servers, and you can network the server to all of your operatories. It will load onto PCs, it will load onto laptops, it will load onto Apple computers, it will load onto the internet and play on the cloud system. It will load on tablets, and it will load on smartphones. So there's a lot of flexibility. This is a single site license, meaning that you can put this software on as many platforms as you'd like within one single office location. So you can have it on a laptop, you can have it on your server network to the operatories, and you can have it on tablets. It's easy to load, it's easy to use. We've got videos to assist all the way through, and we've got free telephone service. You get all of your updates for the first year, and we have many new procedures and 3D animations and program improvements, etc. coming out during this next, actually 2 to 3 years. But during this next year, you'll see quite a lot of them, all at no charge. They come online and automatic, so there's nothing to load or have to deal with over and over. There are some unique features with this program which will allow you to add your own images to the program, which have been fantastic. You can also edit any of the procedure text so it will be specific to you. Let's take a look at how the program works. This is the screen size. It will size to any screen size that you have, any monitor. This is a smart menu and a traditional menu. The traditional menu is just a backdrop, drops down, pick out whatever it is that you'd like. Or you go into the smart menu, click into the box, and type in 1 or 2 letters of something or other, and everything that has those letters in it will drop down and allow you to take a look at. So once you click that, you go to 4 on 4, an example, and here we are. This is the image, this is animation, and this is the movie.
A dental implant is a substitute for teeth.
And how all of this works is just this way. Let's go back to home whitening as example. So you can bring in your own images. Just click on the image, size it, move it around, do whatever you like. You want to make that an icon and get it out of the way, that's fine. Click the design button at the top, click add element, and then go add as many things as you'd like to that particular page, and you can add as many and as often as you'd like as well. So we'll just put a couple of those things up here for now, and again, each of these can be shrunk down or moved around or whatever. You can just make it whatever will help you educate and or sell dentistry. You can bring into the program, and then you can save those as part of your program, and or you can get them to go away and just the default will come back up. Animation plays from 5 to 25 seconds. It's a good explanation, a visual explanation to complement what the dentist tells their patient. Patients don't understand dentistry. They have to see it in order to understand. And then, of course, a movie is from 2 to 2.5 minutes long.
Tooth whitening is the #1 request.
You can play the animation audible, and you can play movies audible in English or Spanish. Then there's a play bar where you can drag it around to someplace along the line, and you can stop it and draw on it and talk about it or whatever you want to do. If you want this to play full screen, all you do is click this icon to the side and it will play full screen, regardless of what it is. Now if you want to play a sequence of movies, we have a playlist up here at the top, and you click that, and these are all of the movies on the far left that we have in the program. You can play one of them by just clicking on and playing it.
Tooth whitening is the #1 request.
Or you can click and create a playlist. Let's just go 4 or 5 of these things in a row. There's enough. So I have a playlist of these things, and maybe what I want to do is start with gum disease, and you can move these around so they'll be exactly what you want them to be. Now let's do laser up here too, and this one probably there. So I have a play sequence now that I'm comfortable with, and I can, so I'll do a test 1 and I can save that as whatever I'd like, and it shows up into the save category. I can play it, it will play from top to bottom, with it will look as though it was just one movie, then it will stop. Or I can click the loop and that will play from top to bottom, then it will rotate and go back up and begin playing, and it will continually loop over and over as though it was just one long huge movie. You can clear the list, you can do whatever you'd like. I can also recall whatever I've got playing. So you can create multiple playlists in both English or Spanish and have them pre-prepared. How do you do that in Spanish? Let's just clear the list. Let's go to settings and select which language that you're going to play that in. So now I'm in Spanish. I go back to playlist. I can play any one of them just in Spanish.
Blanqueamiento de dientes es
Or I can create my own playlist in Spanish. And then I can save that. But I would recommend that you save it with some sort of indication that it's in Spanish so that you recognize which ones are which. So that's saved, and I've cleared the list, and now let's bring that back in and play it.
Blanqueamiento de dientes es el proceso.
It's really that simple. And to go back and change it from English to Spanish is just, you can toggle back and forth all day long. Okay, let's take a look at how to add let's do an email of some sort. So I've got these pictures right here, and I want to email these to my patient so that they can share that information with their loved ones at home. And you can type in whatever test message that you want to type in as well. If we can spell, that would even be better. And then click current. It attaches everything that's on the screen and you send it. As we're waiting for that email to come in to me, there's text. Whenever you play something audible, where there's text someplace, well, here's the text. And you can change the text yourself. You can type in whatever you want. And once that's in there, you can save it. And then the next time you bring that up, that's the text that will be sent along with the email and or printed. It is not text that will be read audibly. It doesn't decipher that. Whenever you play something audible, it plays the default text. I'd like to go back to the default text. You just simply go to default and it brings it back to normal, and that will be there the next time that you bring that up. So you can change the text, you can change the informed consent any way that you'd like, and save it and print it and or send an email. You can also translate this text to something other than English or Spanish, and let's say German as example. And there it is. It's just that fast. And if you want to go from German to Swedish, you can go from one language to the other, and get that printed out so that the patient better understands if it's a benefit for you. And I'll go back to default, and there we go. Let's take a look and see if we've got an email yet. And there it is. It says from, when you register your program, your name will be here. Procedure links. Let's take a look. There's the images that I sent. Here's the test message. Here's all of the text that I sent. And of course you can download these, or they can download these and see the full size of each of those images. So regardless if there are images that came with the program or your images that you just drug into the program, your patients can see everything that you showed them chairside, and they can share it with them with their family at home. This is one heck of a product. It's a great tool. Let's just take a look at some of the different designs, and we've got missing teeth, we've got implants and implant animations and denture overviews, and everything has movies and it has animations. CT guided. We have Straumann implants. Bridge options, fixed bridge. So you show what the bridge is all about, but then, and as you show it, you explain that you actually have to destroy 2 good teeth and in order to put the crown and bridge on, and then you say there's a couple of other areas we should talk about, such as there's going to be gum shrinkage here, and this is a good time to use your drawing tool and say this gum is going to shrink because there's nothing to hold it in here. So we've got this area that we have to deal with, and at some point jawbone will shrink this way as well. And what we're afraid of is, unless you really do an outstanding job in brushing and flossing, is that we're going to have some root exposure that will be sensitive and or susceptible to root caries or cavities, and there'll be a deficit here in your jaw. Now, if you'd like, I'd be happy to show you what the latest dental options are. Well, of course they want to see the options. So now you show an implant and then go right back up to a dental implant and how the animation works, etc. It's a tool that moves fast. It's one that you can customize, and it's one that you can share all of the information with your patient. Give us a call. We'd like to help. 916-988-2323. We'd be happy to give you a 30-day trial.